Good afternoon, everybody, or whatever time it is when you're watching this. Welcome to our Business After COVID-19 webinar, Getting Back to Normal. This is going to be about 30 to 45-minute long webinar that's going to talk about some of the ways that we can get back to normal after coming through COVID-19. So what are we going to talk about today? Well, you're going to meet me, learn a little bit about me, learn a bit about SARS-CoV-2, talk a little bit about restoration, talk about some cleaning products, how to initially clean your business, what type of ongoing cleaning you should do, how to keep your employees safe, how to keep your customers safe. We'll talk about recovery, talk about some long-term prevention, and then we'll talk about some key takeaways. You'll have an opportunity to learn about some of the consultations that we can provide you. And then you'll learn how to get a hold of us. That's the important thing, isn't it? So, my name is Matthew Woodall. I am the owner and lead consultant of RMR Safety Products and Services in Regina, Saskatchewan. I am quite happy to be able to do this. This is actually the second webinar that I've done on this subject today. The first one was with a local Facebook group. I am a former emergency manager with the Ministry of Health here in Saskatchewan. I also used to be a firefighter and first responder, as well as an emergency dispatcher. I've spent most of my life working in emergency services of one type or another. So let's talk about SARS-CoV-2. So this is the virus that's responsible for COVID-19. So COVID-19 is the illness, and SARS-CoV-2 is the actual vector or virus that's responsible for causing COVID-19. Now, it is held together by lipids. These gray spots here, these gray areas here, are basically a type of fat. And that is why for cleaning your hands, soap and water is actually the best option because the soap is going to dissolve the fats. However, it does survive up to several days when it's undisturbed on hard surfaces. It has been shown to last for kind of 3 to 5 days when it's not disturbed on certain surfaces. So when we're talking about restoration, this is what we're talking about. Really, it's the short-term resumption of services. We're not going back to normal. We're talking about starting up some services again after we have had them closed down. It's also about finding the new normal, finding the point of equilibrium, the balance point between what we had in the past and what it is that we're going to have to do in the future. We can't go back to before. We will never go back to the way that we were. We have to move forward. Elizabeth Edwards has unfortunately passed away, but she was an acclaimed U.S. Lawyer and author, and also happened to be the wife of a former U.S. presidential candidate. She says that resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it, you can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. And that's what we're doing here. We have a new reality. We have a new reality post COVID-19. And we can fight it, we can yell, we can be really upset about the fact that things have changed, or we can accept it and we can move forward. And I think the best way for us to do that is to move forward together and put together something that's good for all of us. So we are going to want to make sure that you choose the cleaning products that have been approved by Health Canada. I am going to include this link in the posts when I put this up on the pages afterwards. But we want to make sure that we're using those really good cleaning products. Um, there is no evidence that shows that things like vinegar or those types of things work against COVID-19, work against the SARS-CoV-2. Um, we want to make sure that we're using those cleaning products that have been approved, and those are actually the chemical cleaners. And what we're really talking about is alcohol-based products, because what those do is they dissolve the protective lipids around the SARS-CoV-2 virus, and that actually breaks it down. Quaternary ammonium disinfectants. These are sometimes called quats. These are quite regularly used in healthcare and food service industries. What they do is they're going to attack the protein and lipid structures. So not only those fats that hold it together, but also the proteins that make up the virus itself, and that's going to take away the root of infection, the way the pathogen usually is going to infect people. Bleach and other oxidizers, including hydrogen peroxide. So something like Virox, if you've ever seen that in healthcare facilities. What they're going to do is they're going to break down the virus and make it inert so that it doesn't. Health Canada actually has two lists up. The first is one that is for surface cleaning. So that's for cleaning hard surfaces. Now, let's be clear. When we're talking about the things that are being used by Health Canada, the ones that are approved, these are disinfectants. And there's actually going to be two steps that you want to do. First of all, you want to give it a good cleaning with just hot soapy water. Then after that, you're going to want to use the disinfectants to clean the surface and make sure that the surface itself is disinfected. The other one that you have is hand sanitizers. And those are regulated by Health Canada. So you need to make sure that if you are using hand sanitizers, and we're not talking soaps, we're talking about the waterless hand sanitizers, alcohol-based or that type of thing, that you're using one that's approved by Health Canada. When we are talking about soaps, we want to be really clear that any soap is going to work. It doesn't have to be an antibacterial soap. And in fact, antibacterial soaps are not recommended simply because they are for bacteria and not for viruses. Any soap is going to work. You want to make sure, though, that you are using hot soap and water and you are washing for at least 20 seconds. When we do our initial cleaning, and this is going to be your hot soapy water, we want to make sure that we are cleaning as many surfaces as possible. We want to make sure that we're finding all of those high touch areas, the places where lots of people are going to touch, the places that lots of people, um, their hands are going to come into contact, in those places where the um, uh, the virus could actually spread from person to person. And so all of these places we want to initially clean with hot soapy water, and then we want to make sure that we disinfect it afterwards. In our initial cleaning, though, there are some points that we want to be really sure, both for the initial cleaning and for the sanitizing, that we are getting those high touch areas. And so some of them would be like our door fobs, door handles, and that type of thing. I know that for me personally, those are places that I tend to touch a lot. Door handles, quite obviously, but also around the doors. If a door is open, if it doesn't require a handle to be turned or something like that, then I'm not going to touch that handle itself because I know that it's a high traffic area and a place where germs are likely to live. I will actually touch elsewhere on the door. So we want to make sure that we are doing all of our doors, not just the handles, and that we make sure that we get our card fobs, our card or fob readers. Touch screens and televisions. This is one that we may not necessarily think of, but a lot of places with televisions or with touchscreen devices, these are obviously by their very nature high touch areas. And so we need to make sure that we're cleaning those with an appropriate cleaner that's not going to damage the item, but it's also going to make sure that we clean and disinfect it properly. Tables and chairs. These, again, these are places that we don't necessarily think of, but it's very important that we clean those. And not just the tables, but that we get all of the chairs itself. Given how people adjust chairs and that type of thing, we want to make sure that we are cleaning those properly. And they need to be cleaned every time they are turned over. That also includes stools and places where people may use other pieces around the room, architecture, that type of thing, to stabilize themselves. Places where they may touch in order to get on and off of chairs or to readjust themselves while they're sitting on chairs. Now, one of the more challenging ones is going to be those pieces that are made of soft fabrics, pieces that can't easily be wiped. So those will also be things like our carpets, um, couches, chairs, those types of things that can't be wiped easily. Those will need to be steam cleaned in order to make sure that we are cleaning those properly, and they'll need to be steam cleaned regularly. One of the things that's going to be really important as we do both the initial cleaning and as we do regular disinfection and regular cleaning afterwards is that we are going to want to make sure that we are transparent and we are public about the steps that we are taking. We want to be sure that we are doing those things that are going to help us help our customers feel comfortable uh, getting in coming back to the store and in trying to resume something similar to a normal life. So we want to make sure that we are public and we are transparent, and that our customers know the steps that we're taking. It's even more important that our employees know. We want to make sure that our employees are aware and that they are engaged and enabled to be part of that process. They are going to have a great idea of the places that need to be cleaned. They are going to be a force multiplier for you. So it's really important that if you are a business owner, that you are including these people, you are including your staff and employees in the cleaning process so that they are aware. Now, ongoing cleaning is going to be a challenge. We are going to have to be doing a lot more cleaning than ever before. And that applies to every single jurisdiction, every single sector, every single type of business. Restaurants, in this case, I chose an image of a restaurant because they are going to have some specific challenges because of the way that they do things. Storing stuff out in the open um, isn't going to be possible. All of those plates, if they are left out, they're going to need to be cleaned nightly. They're going to need to be um, basically, if they've been out, they need to go through the dishwasher nightly. Going through the dishwasher is perfectly fine. It's an acceptable way to clean them. But things like storing plates out, storing bars, storing glasses above bars, those types of things, those are all going to have to be cleaned regularly. Um, Along with that, stuff like bottles. A lot of restaurants use these plastic bottles, and it's a great way. I used to work in back of house. I've spent lots of time over a grill. These are great things, but with COVID-19 and the way that it can stick around, rather with SARS-CoV-2, and the way that it can stick around on surfaces, we need to make sure that we are cleaning these every single night. And if not every single night, then we need to make sure that we're switching that we're cleaning them more often than that. Once a day is a bare minimum. Surfaces are going to need to be wiped down regularly. Now, restaurants are great at this. Restaurants are absolutely fantastic. They wipe down surfaces all the time, but they're going to need to be wiped down in all types of businesses. If it's got a place where SARS-CoV-2 can settle, then it needs to be wiped down all the time. And the other place to think about is uniforms. Uh, Uniforms, it's not going to be a matter of you can wear the same uniform for 2 or 3 days in a row. If your staff wear a uniform, if you wear a uniform at work, you need to make sure that you are changing that uniform every day. That means that businesses may need to supply more uniforms to their staff. It means that staff need to take the onus on themselves to take those home and clean them, or that businesses may need to actually start a laundry service so that uniforms do get cleaned, and they can guarantee that. Again, what's going to be really important is not only doing the work, but proving that you have done the work and proving that things are clean. That is the way that we are going to get back to some type of new normal. So employee safety, this is one that a lot of people are concerned about. This is one that people have questions about, that is going to make things challenging for a lot of people, because as good employers, you want to make sure that your employees are safe. You want to make sure that you're following your occupational health and safety legislation, but more than that, as a good employer, you want your employees to be able to go home every day. So there are lots of questions around masks. um, let's be clear, most employees are not going to require masks. There are some exceptions to that, specifically in sectors where people work closely with other people, where they are right up and personal with other people. If they're going to be within that 6 foot distance on a regular basis, then yes, they are going to need to wear a mask. So in this case, I'm thinking salon customers, salon employees, barbers, hairstylists, chiropractors, optometrists, dentists, masseuse, massage therapists, those types of people, they are all going to need to be wearing masks, and they're going to need to be wearing gowns, and they're going to need to be wearing some type of facial protection, whether it be um, goggles, or glasses, as seen in this picture, whether it's one of those visors that are being mass produced around the world by people with 3D printers. They are going to need that. With very few exceptions, and probably um, the only exceptions that I can think of for businesses that are not operating right now, um, and that would be dentists. Unless you are doing something that is going to cause aerosolized droplets, that is going to expel droplets from the mouth, then you don't need an N95 mask. And an N95 mask comes with particular liabilities that you as an employer and you as an employee need to make sure that you're familiar with. If you are going to use an N95 mask, you have to be fit tested for it. You have to have a specific type of mask available. So the one that fits you best, you always have to have that available. You can't just swap out any N95. You have to use the same one. And you have to be fit tested regularly. And so most people, though, are going to be just fine with a procedure mask or a surgical mask, such as the one that's in the image here. You are going to need to make sure, though, that you have enough of them, and that you change them between every single client. It's not something that you can just wear all day. It's something that needs to be changed between every client. Your eye protection is going to need to be cleaned and disinfected between every client, which is going to take a little bit of time. So you need to make sure that you include that in your um, in your reopening procedures. You may want to choose to do something like screening. You may want to limit the number of people inside your store to make sure that that physical distancing is still happening. You may want to take stricter precautions and actually ask people about recent travel or possible exposure to people with COVID-19 symptoms. Um, However you do that, that's up to you. At the end of the day, your store is your property, and you have the right to refuse access to anyone as long as it is not an unreasonable refusal. You can't refuse to serve somebody because of the color of their skin. You can't refuse to serve somebody because they have a service dog. However, if it's a public safety, if it's a public health concern, then certainly it would be within your rights to say, thank you for coming. We're happy to have you here, but I can't let you in the store until somebody else comes in. Or, you know what? You have had exposure to somebody with COVID-19 symptoms, and so we need to ask that you go home. The other part of this is that you, as an employee and you, as an employer, need to make sure that you have an effective illness policy. If somebody is sick, they do not come into work, period. If somebody starts feeling sick while they're at work, they go home. This is going to cause a little bit of problem for employers. This is going to make things a little bit more challenging. But the reality is that um, you need to make sure that people are not working while they are sick. If you need some help with something like that, then we'll talk about that in a little bit when we get to the consultation. The other thing is gloves. Now, truth be told, most people who are wearing gloves now don't need to be wearing gloves. And most people who are wearing gloves now out in the public are not wearing them properly. If you are going to wear gloves, if they are going to be part of the PPE, the personal protective equipment for your employees, then you need to make sure that they know when to change them and that they know how to take them on and off safely. Gloves are great, but they are intended to be used for one task only, and then they need to be changed. So if you are in a grocery store stocking shelves with gloves, as soon as you finish one box, then you need to switch your gloves. If you are in a restaurant and you are serving with gloves, as soon as you're done one table, you need to swap those gloves out and you need to put a fresh set of gloves on. You also need to be properly trained, whether it be masks or goggles or gloves. You need to be properly trained, and your employer needs to provide you training on how to safely don and doff that protective equipment. You need to make sure that your employer teaches you how to do that and how to do it safely. When we're talking about your customers, there are some things that we need to make sure. And at the end of the day, the safety of your customers is going to be the thing that's going to bring them back. Once they feel safe coming back into your store, they are going to come back. And we've seen that. I have seen that in Facebook groups. I have seen that in lots of places where people aren't asking, is the food good at this restaurant? They're asking, is it safe to order from this restaurant? That's what's really going to need to happen. And so this is where the transparency and the openness about the things that you are doing will come in. This is where you need to be really transparent and really honest about the things that you do. And you need to be seen to do the things that you're doing. So things like having iPads for ordering, they need to be wiped down after every every single person. Same with your point of sale systems, your debit and credit card machines. They need to be wiped down with every single person. Countertops, shelves, those types of things. You need to be seen to be actively cleaning, and that's going to help your customers feel safe. The other thing that you may want to consider is establishing a single route through the store. You may want to have an entrance point that is different from your exit point. And we've seen this at some big box retailers where the entrance door and the exit door are two separate things. And that's something that you may want to consider, particularly if you have the space to do that. That's going to help your customers feel safer. That's going to help them take feel enabled and empowered to be safe in your store. The same goes for one-way traffic in aisles. Those are all things that you can do to help your customers feel safe. So what are we talking about in terms of a timeline? I mean, that's what everybody really wants to know. Um, what are we going to get back to normal? And I can't tell you that. There are so many variables right now. The biggest one being when is a vaccine going to be available, and when are we going to see large scale immunity towards um, SARS-CoV-2? I can give you an idea of the steps that are going to happen. So we have the incident, we have the COVID-19 pandemic. And While this didn't really hit the news for a lot of people until late February, early March, I can say that this was on the radar of um, public health professionals and emergency management professionals way back in December. We were watching this and we had our eye on it. So this is not something where people have just kind of jumped into the fray. This was something that was very closely observed right from the beginning. Right now, we're in the response phase. And this is where we do the physical distancing, where we close businesses, we shut everything down to try and keep things from spreading, to try and make them as safe as possible. Um, and that's where we are now, and we are slowly transitioning into the restoration. And this is in Saskatchewan. This is where we have started into this phased restoration, this phased reopening of things, where we start easing the response measures. We open up some businesses, we start increasing the size of public gatherings. Now, let's be clear, just because we're stepping into restoration now doesn't mean that we're not going to go back into response. Um, it's entirely possible, and we have seen this in other pandemics, and we're seeing this even now in other countries with COVID-19, where they have started to ease the response measures, and then cases have begun to ramp up again, and so they have gone right back into response. So don't be surprised if we are going to end up um, going back into response, and if we're not totally done with physical distancing. Then we move into our short-term recovery, and this is really what we're talking about here. This is where what we're talking with premise cleaning. We're talking trying to make sure that things are cleaned and sanitized and safe for people to go back into. We're also talking about testing and antibody testing to make sure that we understand the spread of the virus, and as that we understand who may or may not be immune to it. We are discovering that there is science out there right now that having had COVID-19 is not enough to make you immune to it, that people are being reinfected with COVID-19 after they have had it once and recovered. So until we understand exactly how to make sure that people are immune and exactly how many people have this, we're not going to be able to move out of the full response phase. Then we're going to move into kind of our long-term prevention. And this is where we get into things like treatments and vaccinations and some big sector-wide changes that we don't really know quite yet. Vaccinations and treatments are going to be really important. Until we can treat and prevent this disease, we aren't going to be able to get back to anything like normal. We are going to see some massive changes in some sectors. Some sectors like travel, some sectors like vacations, even leisure things like movie theaters. We are likely to see some significant changes in those in terms of how many people can be in one space at one time and how they go about protecting people while they're on there. And then eventually we're going to get to our new normal. I can't tell you when that will be. I can't tell you what that will look like, but those are the steps that we need to get through to get to that new normal. So, what do you need to take away from this? So, COVID-19 is a disease and it's caused by SARS-CoV-2, which is a coronavirus. Now, coronaviruses are not new. This SARS-CoV-2 is new, but coronaviruses themselves are not new. There have been two other significant epidemics, one being SARS in 2003, the second one being MERS, the Middle East Respiratory Syndrome, and MERS is actually ongoing right now. Coronaviruses also cause things like the common cold. So this is something that scientists are somewhat familiar with, but they aren't as familiar with this one specific one. SARS-CoV-2 as a virus is easily cleaned using readily available products. So the most readily available is going to be simple soap and water. To disinfect, you're going to want to use bleach. Just plain bleach works. Certainly, if you want something a little more potent, then that's available. Um, we do carry some on our website, and we're quite happy to refer you there. But what's really important right now is that we want people to have access to as much as possible. And so, if bleach is what works for you and what you can get, then use bleach. Recovery is an ongoing process. Um, we are starting the reopening process. This is being recorded the end of April 2020. We are starting the reopening process in many places right now. In terms of being fully recovered, that will take weeks or months or maybe even years. We want to make sure that the long-term recovery actions that we take, so things like vaccines and treatments, are designed to build resilience towards this. We don't want to um, take actions that are going to leave us open to having this come back in the future. Safety precautions are going to be around for a while. Physical distancing, masks, those types of things, a lot of those may actually be here to stay. This morning, in the webinar that I was on with the Facebook group, I Support Local Business Regina, they asked about the plexiglass barriers. And in a lot of cases, those may be here to stay. It really depends on what kind of image you want to put forward to your customer. If you're comfortable having that plexiglass barrier be part of your image, and truthfully, the longer that they are here, the more likely they are to stay for a long time. And lastly, we don't know what the new normal looks like. We don't know which of these precautions are going to stay. We don't know how businesses are going to change. We don't know any of these things yet. We have some idea. We have some ideas of what might happen, but until we get to that new point of equilibrium, that new normal, we aren't going to know what it looks like. So, for those of you who are watching live on Facebook, there is an opportunity for you to ask questions. Please leave those as a comment. I will be able to see them, and I will um, ask or I will answer them as best as possible. I am seeing that there are only two viewers at the moment. So if you are watching this later, please leave a comment. I will make sure that I get back to you as soon as possible. For those of you who are watching right now, please feel free to leave a comment or to ask a question, and I will try and get to it in the next couple minutes before we end here. But I do want to let you know that one of the things that that I am trying to do is to be able to provide these consultations and to be able to provide support to local businesses at a price that is affordable and that type of thing. So I am quite happy to come out and work with you and to provide consultations about some of these things. Um, and so emergency management response planning, and this is something that a lot of people haven't thought about, but a lot of people are doing without even thinking about it. And so I think about something like what Cisco is doing, where they are having truckload sales to the public. Um, That's not their business. They don't sell to the public. They sell to restaurants. But they were able to look at their product and look at their locations and say, hey, in this type of emergency, we are able to do this. And so, what emergency management response planning is about how you as a business, you as an organization, are going to respond to some type of emergency that happens outside of your business. The flip side of that is business continuity planning, which is really about how do you as a business respond to something that happens to your business. How do we make sure that things operate? And so what we've seen with the working from home, that is a very valid and very important business continuity strategy. To have people work from home is absolutely a great business continuity idea. And so a lot of business continuity planning is how do we keep businesses working when something goes wrong? I am more than happy. And if you are within Regina, if you are within the Regina area, kind of as far as Moose Jaw or Fort Capel, I will come out and I will do this at no charge to you. I will come out and I'll walk through your facility or your office with you, and we'll talk about what needs to be deep cleaned. Where do you need to focus your attention? What are those high touch areas that you need to think about when you are doing your cleaning? Also quite happy to come out and do first aid and safety assessments. A lot of people don't realize that first aid products actually have an expiry date, after which largely it has to do with sterility. And after the expiry date, the manufacturers can't guarantee that items will be sterile or still good for use. But I'm happy to come out and do a first aid and safety assessment with you to say, so this is what you need based on your business. These are your areas of concern, and this is how I can help you. And the last piece is, especially for those of you who have to create some new policy and some new training coming out of COVID-19. Um, I was a policy and program consultant in the emergency management unit with the Provincial Ministry of Health. Policy and training is part of my background and part of what I am excited about being able to do, which is very weird when you think about it to say that someone's excited about policy. But really, it's really about making sure that you have the tools that you need as a business owner, as an employee, as an organization to make sure that things are as safe as possible. And that's that. Um, if you are looking to get a hold of me, if you'd like some more information, please don't hesitate to get a hold of me. Um, there are lots of ways to get a hold of me. Um, Website and email is usually the easiest. During business hours, you can usually catch me on the phone. Um, Feel free to visit us on Facebook. We share a lot of resources on Facebook. We're also on LinkedIn, both me personally as a person and RMR Safety as a company. We are a new business. We officially started a month ago, I think, or so. Um, been around a little bit longer, but officially we are about a month old, and we're going to be doing a lot of this stuff. We're going to be doing a lot of information sharing and that type of thing. So please don't hesitate to like us on Facebook, find out more about what we do, and connect with us there. With that, I don't see any questions, but certainly don't hesitate to contact me. Thank you very much to everybody who joined me live and who are watching this in the future. I really appreciate your support and look forward to talking with you soon. Have yourselves a great day.